Hello, my name is Dr. Joe Ferrantelli, and I'd like to take a moment to introduce you to the CBP Traction Setups and Log Manuals designed by Dr. Deed Harrison and myself. This was born out of necessity in our offices and amongst talking to our peers, in that when you hit a threshold and you become busy, sometimes the CAs or the back office doctors tend to forget how to set the person up specifically for their spinal displacements, and they wind up setting up the person inappropriately in traction, and thus you won't get the proper corrections that you are aiming for with your protocol of care. So what we designed is a simple system with a menu interface here that has all the specific types of traction that one would have in a CBP practice. And what this allows you to do is print out a travel card specific to that patient, which you staple to your existing travel card, or you put it in a 3-ring binder in your rehab room for your CA to look up the appropriate traction. For instance, if your patient needs to do 2-way compression extension traction, you go over to the 2-way button here, and here are all the different types of traction for 2-way compression extension. Notice how the angle of the strap in the anterior pull is in a different position. This is something that the CA needs to be aware of. So if they are going to do this type of traction, you go ahead and prescribe it by clicking this button, and it's going to open up a PDF file, which is the actual travel card that you'll print out. Now notice, what you have here is a log of 40 visits, and you log the anterior weight, the head weight, and a time. Also here for the CA is the angle of pull to horizontal, as well as the ratio from front to back weights, and notes on the setup. Okay, and all you would do is just print this out, and it would be in color. And I like to print it out on cardstock paper, that way it's a little bit thicker, and I have a very good color laser printer, so it comes out very nice looking and very professional, and the CA will go ahead and know how to set that person up appropriately. Another example is if they wanted to do the target force regainer system. We have that as well here too. Okay, with the angle of pull as well. Going back to the menu, you'll see that when you scroll over, we have virtually all the types of setups that one could do. If you're going to be doing lumbar traction, as you scroll through, all the different setups are there for you to print out. This is the hardest point to convey to your back office staff, because, for instance, this posture sometimes is confused by this posture. The angle is different, the straps are different, but in a busy office, your CA sometimes will forget to put the block under their rib cage, or change the angle of pull. Okay, going back, here is the regular regainer unit by Dwight DeGeorge and Promote Chiropractic. So all the different setups that you can do with this, and then using a bungee cord for children. Moving back, 2-way extension, the Pope unit, if you need to do distraction or extension distraction with your radiculopathy patients. 2-way, the different setups, different harnesses. And we explain all these setups in our seminars using the cervical modeling collar designed by Dr. Don Meyer. Posture pump, 2 different main setups. Posture pump while on a backswing for the low back, and cervical posture pump. Standing traction. All the different setups that you could use this unit for. So as you can see, this makes your life a lot easier, especially with translation traction. All the different types of setups are there for the most common postures. Now obviously these are the most common postures. You may have to take some notes and put them on specific for your patient, but this covers most of the setups that you're going to encounter in clinical practice. Here's Dr. Don Meyer's stand-up traction unit for XC traction. Okay, you can see all the different setups. So this took us quite some time to compile all these different setups for you. Even doing sideline traction, very effective in certain cases of scoliosis, as well as the remodeling brace, different forms for using the remodeling brace. So if you were going to print this out, all I would have to do is hit this button and it would open up that file and that log specific to the travel card, and you just staple that to your existing sheet. And that is it. If you have any other questions, feel free to contact us at sales@idealspine.com. Thank you.